Did you know that tailbone pain or coccyx pain is one of the most excruciatingly painful diagnoses that we see in the clinic nowadays? 1 in every 5 back pains have some kind of tailbone complications. If at this point you're without help, if you would like to expedite your recovery and learn more about self-help strategies to help you come out of back pain, pelvic pain, or any other pelvic related diagnoses, please pause this video and subscribe to our channel. That way you are notified of any new videos that come out and you are up to date with the latest information that I am sending out. My name is Dr. Amruta Inamdar. I am a pelvic floor rehabilitation specialist. That is a physical therapist specializing in pelvic floor dysfunction. To date, I have seen more than 5,000 patients with pelvic floor related issues with excellent results. Have you been struggling with relentless, severe low back pain at the very bottom part of your back or your tailbone? You're struggling to understand what's going on and you cannot know where to start. I want you to pause this video right now and comment below and let me know either yes or no and what exactly your problem is. That way I'm able to help you one-on-one through these comments. Vast majority of patients suffering from severe pain in your tailbone do not have any idea where to start with, and more importantly, do not have access to a pelvic floor physical therapist. So in this video, it is my attempt to bring to you the 5 most effective strategies that I have known in my clinic that have helped my patients get rid or at least get this pain under control. Let's begin. Before we begin our exercises, I would like you to quickly understand what and why we are doing so that you have a clear understanding of the techniques that we are going to learn. Okay, so over here I have a close to life size model of a pelvis. All right, anything that's white is a bone, anything that's pink is a muscle. Now we are going to look at the pelvis from the back. Okay, so we are looking at the sacrum, the back part of your pelvis, and if you see, the end part of the sacrum is your tailbone. Okay, now many people get this injury when they fall directly on their tailbone. Sometimes women get this injury when they give birth, or if there's any vacuum used during birth or any other issues where you have direct injury or trauma over the tailbone. Now I want you to closely look at how these muscles are situated that are attached to the tailbone, right? So this is the bone in the center and these are the muscles that attach directly to the tailbone. All right, now obviously these muscles are very close to your rectal opening and these muscles are an integral part of the pelvic floor. So when we learn the exercises, I'm going to show you techniques to release these muscles. You gotta see a pelvic floor PT if you do have access to pelvic floor PT, because they are highly specialized and trained to palpate your tailbone rectally. So we do palpate tailbones rectally and find out where exactly the tailbone has moved, right? Very commonly, tailbone gets flexed underneath, right? With birth injuries or with traumas where you hit the tailbone directly, the tailbone gets flexed inside. Or sometimes the tailbone gets deviated to one side or the other. Pelvic floor PT will be able to tell you exactly what's going on. However, if you do not have access to a pelvic floor PT, or if you don't know anyone who specializes in this field, then I'm going to give you a few self-help tips over here. The number one problem that people with tailbone pain have is they cannot sit without pain. That's the biggest issue that everyone faces, right? So the first technique that I'm going to show you is to kind of try and figure out a method by which you don't have to spend a lot of money, you don't have to invest in a lot of gadgets and other stuff, and you still should be able to sit without pain. Okay, so you're going to use like a thicker towel, okay, just like this, and you're going to roll it up like how I'm showing you. Right? Now you're going to make like a V-shaped structure just like this, and you're going to try and sit on it. So this is like a makeshift technique when you have no help. So I'm going to try and sit on this. So if you try and see your sit bones, I'm basically trying to get the towel underneath these two sit bones. That way my tailbone keeps floating, or it doesn't bear the brunt of my body weight. Okay, so this is something that you could try immediately at home. Make sure that you have a towel that's not very thin. It should be slightly squishy. That way you are slightly elevated from the ground or the surface that you're sitting on. Okay, so in this technique, now we are going to learn how to actually release the muscles that are attached to the tailbone if you don't have any help, if you don't have access to a pelvic PT. Okay, so generally what happens is when you fall or when you have injury to the tailbone either flexes underneath, right, or it shifts to one side or the other, right? The way you know what side is affected is you have to palpate the muscles that are underneath your glutes and try and feel which side is more painful and more under tension. Okay, that is the side that's going to need your treatment. All right, so for example, you're going to feel, so you're going to put your hand underneath your sit bone, right? So let me move this pelvis away. Okay, put your hand underneath your sit bone and you feel inside of that hand. So if your hand is underneath here, you're going to feel inside, okay, part of that sit bone area, and you're going to try and see what side is more painful. Now if you have this injury that's really bad, you're going to experience one side is more painful than the other. Okay, once you locate that, the next step is to take a ball. So I've taken like a tennis ball here, okay, and you're going to try and place this ball between the tailbone and the sit bone. How would you know? You're going to locate the sit bone underneath where you sit, and you're going to place the ball inside of that, right? So let's practice placing that ball. So I'm going to believe that my right side is painful, right? So what I'm going to do is, the first step is I'm going to try and palpate the sit bone and then place the ball inside that sit bone area. So let me show you just to give you some clarity. So I'm going to turn around here. Okay, so I'm placing my hand here. This is my sit bone. I'm going to place the ball inside my sit bone, really close to the rectal opening, but not really on it. Okay, and you're going to lay your body weight on it. Okay, initially it's going to feel almost like, you know, literally like someone is punching like a fist there, right? But what you got to do is you got to breathe into the ball and try and relax the muscles. That way the tightness or the trigger points that are in that area let go. Okay, so let's practice. So I'm going to put the ball underneath my right sit bone, sit on it. Okay, it feels like a severe pressure right there. And I'm going to start breathing. So you're going to inhale through your belly, exhale, release your pelvic floor. One more inhale, exhale, release your pelvic floor. Okay, so you're going to do a few breaths till you start experiencing that the pain or the pressure on that, because of that ball, is slowly subsiding. Alright, so let me see. Yeah, this actually does feel softer than the left side. So you have to remember that although one side is more painful, you are also going to do the same technique on the other side, because it's always a good idea to balance out muscles on both the sides of the sit bones and your tailbone. Okay, so this is the second technique. Alright, so after we have released the muscles that are really close to the tailbone with the ball, the next three exercises you're going to do with me are stretches of the muscles that attach really close to the tailbone. Okay, so the first muscle that we are going to release with a stretch is called the piriformis muscle. Alright, the muscle attaches, so it's situated close to inside your gluteal muscle, and it is situated really close to the tailbone. Okay, so I'm going to show you how to do a piriformis stretch without causing more injury. So you're going to lie down. You can either choose to take a pillow underneath your head, or you could choose to do it without it. Right now I have a pillow, so I chose to take that. Okay, so you're going to start with both your legs extended. Now the first step is you're going to bend both your knees and keep your heels as close to your hips as you can get them, right? The next step is you're going to cross this foot over. Okay, so I'm crossing the right heel over my left leg. Make sure there is no pain or no tension in the tailbone area as you do this. All right. Now you're going to gently grab the left-sided leg and pull the leg up towards you. Now when you do this, you're going to start experiencing a tightness or a stretch in the right buttock area. Okay, that is your piriformis muscle. So you're going to hold this stretch. I recommend that my patients hold this stretch from 30 seconds and slowly go up to 2 minutes. So you're going to very gently build up your stamina. Okay, you might not be able to do this stretch for 2 whole minutes on the first day, but the goal is to build it up to 2 minutes. Okay, because this is a postural muscle, you need to stretch it gently for a sustained time. Okay, let's try and see it on the other side as well. So you're going to cross the leg over, right? You're going to hold the leg up. And again, as I said, you should be able to feel a stretch in this area, not immediately. The more you hold it, the more stretch you're going to experience. Okay, so this is the piriformis stretch. You're going to slowly keep the leg down and uncross the foot. So in the next stretch, we are going to talk about our hamstring muscle, which is tight in most of us, right? Now, why are we even stretching the hamstring muscle when we have tailbone injury, right? That's a question that everyone asks me. So the hamstring actually attaches to the sit bone, okay? And through fascial connections, that mean connective tissue connections, there could be pulls on your tailbone. So you have to make sure that your hamstrings are not tight and pulling or tugging on that tailbone, which could increase your pain cycle by getting into like a vicious circle. Okay, so we are going to learn a very basic beginner stretch, which is safe for tailbone injuries. You're going to try this. Again, you want to make sure that you do not do this if you have pain while doing this exercise. Okay, so you're going to lie down on your back. Okay, we are going to try and do this exercise. So you could either do this exercise with your legs bent or your legs straight. Right now, because this video is for tailbone injury, I'm going to show it to you with my leg bent. Okay, so you're going to keep your left leg bent, right leg extended. Alright, now you're going to gently raise your right leg up, and you might not be able to extend it the way I'm doing it, okay, if you are in severe pain. So you're going to try and keep it bent just like this, and you're going to gently try and extend the leg only to the point where you feel a stretch, but there should be no pain. Okay, so pain is bad, you guys. So you should not have pain when you're trying to correct something, right? So you're going to hold the stretch for 30 seconds. And again, build your stamina up to go up to 2 minutes. So when you try and hold this for a longer time, you want to make sure that you do it first without pain. And secondly, you should try and do the stretch without feeling a severe stretch in your hamstrings. So you should gently stretch the muscle, in other words. Okay, so this is going to be extremely beneficial for your tailbone injury. Alright, so let's do it on the other side as well. Legs straight. Make sure that your knee could be a little bent, or if you can pull it up straight, you are welcome to, but make sure there is no pain in your tailbone when you do this again. Okay, so you're going to gently try and extend the knee. Hold this here for 30 seconds. Slowly build your stamina up to 2 minutes. Alright. And you're going to then gently lower your leg and put your leg down. So this last exercise that I'm going to show you is actually my personal favorite. This had helped me recover from my tailbone injury when I had a fall. I'll tell you that story some other day. All right, so this is our tailbone, this is our pelvic floor muscles that are attaching, right? In this next exercise, we are going to synchronize our breathing with the pelvic floor movement. We are going to try and relax the pelvic floor as we breathe. Okay, so let's learn how we are going to do that. Alright, so I want you to first go in a position that we call as a child's pose position. Okay, so you're going to sit with your legs folded or your knees bent. Okay, you're going to open up your knees. Alright, you're going to make sure that your chest is upright. Okay, so don't start with your chest slouched. Alright, chest upright. You're going to raise your arms up and slowly make sure that you extend down on the ground. Make sure that your hips are not getting lifted from the heels. Alright, now in this position, you're going to pay attention to your breath. Okay, so inhale through your tummy and exhale. Every time you inhale, I want you to focus on your sit bone area. That means the area really close to your rectal opening, and you want to make sure that that area shows some kind of expansion or relaxation. So inhale again and exhale. So let me quickly show you what I mean by expanding or relaxing your tailbone. So with every inhale, right, if this is your pelvis, with every inhale, you should be able to feel your sit bones going out and going in. Okay, with every inhale, go out with your sit bones, and every exhale, gently let your sit bones come back. Alright, you're going to try 10 to 15 breaths that are more and more and more relaxed as you practice, and you'll notice a significant difference in your tailbone pain. So if you do find the tips and the exercises that we discussed in today's video helpful and useful, do not forget to subscribe to our channel, and also don't forget to like and share this video to your friends who might be in need of help with getting started with pelvic floor recovery. This is Dr. Amruta Inamdar, your pelvic rehab doc, and I hope to see you in the next video. Until then, always remember that accurate knowledge is your path to recovery.